Hi, welcome to Nurse Rants and Remedies. Today I want to talk to you about a respiratory condition called asthma. Asthma affects young and old, men and women. It may be difficult to diagnose, but I'm thinking if you're on this channel, you either suspect you have asthma or you know you do. Asthma, the word, comes from a Greek term meaning panting. The onset of asthma can be with wheezing, shortness of breath. That's when the airways are tightening and mucus production increases and the lungs are struggling to get air in and out. Asthma is a condition of immune response by the lungs to something like an allergen or an inhalant. You can also get an asthmatic attack if you're having an infection like a bronchitis or a common cold, or if you are exercising or exposed to heat or cold. Asthma may be difficult to diagnose. You may feel short of breath or be coughing at night. You may also feel a rumbling or wheezing in your chest. Get to a practitioner, have them do some pulmonary studies, and figure out if you have asthma. So let's say you have asthma now, and you know it. The best thing that you can do is prevent asthma. Stay away from anyone that has an upper respiratory infection. Make sure you carry your emergency inhaler with you. If you're going to exercise, take 1 or 2 puffs of your inhaler. Be sure after you take your inhalers to rinse your mouth out because they can be caustic and cause ulcerations inside of your mouth. You need to take preventative medication. Prevention is the best way to treat asthma. If you're taking your rescue inhaler more than 2 to 3 times a week, that should be a cue that your asthma is not in good control. Other things that you can do to control asthma. There's a lot of literature out there about hot liquids and caffeine as a preventative if you feel an attack coming on. Obviously, you should use your medications, but if you didn't have them, you might be able to drink something hot or some liquids and it might set it off a little bit. The other thing is, recent studies have shown that asthma sufferers do better if they take 1 gram to 1.5 grams of vitamin C daily. Also, if you take a magnesium and vitamin B supplement. Another study shows that people who eat things that are not processed and more natural, like the Mediterranean diet, have better effects on their lungs and less asthma attacks than people who don't. The Mediterranean diet is full of natural oils, fish oils, also legumes, fruits, and vegetables. It's really important that you prevent asthma attacks. If you can lose weight, avoid things like the perfume aisle at the stores, and also avoid smoking and known allergens. You will have less problems with your lungs and do better. If you don't have a home nebulizer, ask for one. Nebulizers are a more efficient way of getting the medication deep within your lungs. They utilize them in hospitals and clinics. Ask your practitioner for a home nebulizer, especially if you have a little one that has asthma. It will soothe them and keep their lungs open. On the 2nd or 3rd day, infections will cause the mucosa in your lungs to swell and become more irritated. Avoid colds and infections at all costs. Some points of interest in closing for asthma. There is a direct correlation between obesity and asthma. It's important to recognize that asthma is an inflammation in the lung. It's an immune response. So most of us go through our lives not even knowing what we are reacting to. Multiple articles, really good articles. Asthma UK, there's also one by Healthline. Multitude of articles suggest that asthma may have a correlation to what you're eating. My own personal experience, I have gone organic into a paleo autoimmune diet, and I have been asthma-free now for almost 6 months. Avoid anything processed, nitrates, sulfates, and even gluten. These things, without us even knowing, may add to the inflammation within our bodies. I'm no dietitian, but I can attest to the fact that
watching what you eat, more natural, healthy, organic, really could be the key to breathing easier. Wishing you well until the next time.